Hi Facebook, good afternoon. How are you? It's Dr. Emily. So just want to shoot a quick video to share with you some of my tips on how all the trainers, the coaches, the therapists, and the doctors can protect ourselves as we go back to seeing our clients and our patients in person. It's obviously going to be a new challenge and new steps that you want to make sure that you're doing so that you protect your clients and your patients, but also to protect yourself. Why it is important to think about protecting yourself, obviously, as a number one priority is that you can't help others if you are sick yourself, and you are the individual that is being encountered with so many different people. So you do want to think about yourself in this situation, as well as, of course, your patients and your clients. Now, a majority of the doctors and the therapists and the trainers that I know that did get coronavirus, it was actually, they got it from their clients and from their patients. I believe that I truly did get coronavirus from one of my patients that I saw in early March. Okay, here we go. Number one, to protect yourself, wear a mask. Of course, that goes without saying. So I saw a patient for the first time in my office, and it was definitely a little bit unsettling. So here in New York City, and having them wearing a mask was obviously very important. They wore a mask, I wore a mask, but the mask that I wore, I wanted to make sure that it would protect myself enough, knowing that I was encountering a stranger or many individuals. So a standard surgical mask, I personally would not wear a standard surgical mask when seeing patients or clients, especially after COVID. So this is where I turn to the KN95s. This is not an N95, this is a KN95 for consumer use. So you can see that it seals so much more around the face. So this is very tight, this is very sealed. You can push this down so you get even more protection. This is gonna give you the protection that you need. This one, or of course, the white one as well, this is a standard one. You probably see this if you go to Starbucks or to Dunkin' Donuts. A lot of the employees are using these. So you wanna make sure that you're wearing a mask to protect yourself. You wanna make sure that the patient or the client is wearing a mask. Now, if the patient or the client is wearing a standard surgical mask, that's fine, right? You, of course, are not going to be seeing them if you're showing signs of any sort of infection. Second thing that you want to do, again, might be common sense, but don't shake their hand, right? So you're doing your introductions and your salutations from a little bit of a distance. And then when they're in your office, you're keeping them at a safe distance compared to where you are and where you're doing your intake forms and your notes. I like to clean the room in front of the patient or clean all of the mats and the weights and everything that you're using. You want to make sure that you are cleaning it with a hospital grade cleaner in front of the client or in front of the patient so that they feel confident in showing that you really respect their health and their safety as well. The fourth thing that you want to do is to maintain that distance. So when I saw a patient in my office, I was actually all the way across the room. You don't have to be that far. She was probably, let's say, a good 15 feet away from me. And I was at my computer. She was where the patient chair is. She was not on the examination table yet. But that's generally where I do my intake forms. And then when I examined her feet, obviously I'm wearing gloves. You want to make sure that you're wearing gloves and that you're taking them off appropriately. And then after I examined her, I then went back to my safe distance, 6 feet distance, and did a continued conversation with her. So primary, a majority, 90% of that office visit, I was in a safe social distant. Yes? And the next thing that you want to do, or what I want to mention to that as well, is if you're a trainer and you're training your clients one-on-one, is you can still maintain a distance. You don't want to have it come across rude in any way, but you could be a couple feet back. They're exercising, right? So they're not going to wear a mask. I don't encourage them to wear a mask, especially if they have any respiratory issues, because they're getting their heart rate up, and you don't want them to start to get lightheaded because they're exercising with a mask on. If they're fine in that situation, great. But if you're protected, they can exercise safe distance from you in that environment without the mask. Now, you have your next client that's coming in. So you better, in front of them, make sure you're cleaning that room. Or if you want to be on the safe side, you're going to train your clients outside so that you are keeping the air clean, safe, sterile for everyone. Number 5 is that I would highly, highly encourage you to change your mask frequently. This is why I have a huge issue with homemade face masks. I understand that they save some of the disposable, the waste, the environment. Totally get that. I'm so pro planet. But if we're thinking of using the same mask day after day after day, and it's in this closed environment, and maybe you're touching it, and then you're going out, and then you're shopping, and then you're touching it, that's so much interaction that you do want to make sure that you are washing it frequently. I would honestly wash it after every use, because you do want to make sure that you are safe and others are safe. So I personally favor the disposable masks. However, the tendency when we use these disposable masks is that we use them several times. So these disposable masks, surgical masks, really those are intended for like one use. When we would use these in the OR, we would do a case, a surgery, call it an hour, and then we'd throw it away, and then we would see the new patient and then put on a new mask. Obviously, we want to do a cost savings here and, like I said, protect the environment. So the ones, these, the N95s, you still do want to make sure that you are either cleaning them in between, putting a little bit of a spray. Obviously, be careful because you have to inhale it, but just make sure that that is a breeding ground in itself, is wearing the same mask too many days in a row and either not cleaning it or not sterilizing it anyway. You could even just put it in the sun for the UV. All right, and then finally, number 6, what you want to do as we get back to seeing our clients and patients is make sure that you are continuing to protect yourself and your immune system with the appropriate supplements. So you want to make sure that you have sufficient vitamin C, vitamin D, vitamin A, drinking enough water, and probiotics. There are many, many other supplements that you can be taking, but just make sure that you're staying on top of your regimen so you can protect yourself, so that you can protect others. Again, just a real quick recap. As we go back to our offices, states are opening up and we are returning to the new normal of treating our patients and seeing our clients is wear a mask. Make sure they're wearing a mask. Make sure you are wearing the appropriate type of mask. Do not rely on your gym or your office to supply a mask for you. We saw exactly what that did to the hospitals. Take your health into your own hands and get the masks yourself. That's my recommendation. Next, make sure that you are not shaking and doing close interactions with the clients. Keep that safe distance. Clean the room, clean the weights directly in front of your clients so that they feel confident and safe. Make sure that any touching of the client is done as brief as possible, and then you go back to that safe distance. Change the mask, mention that, and then keep your supplements and vitamin regimen up to par. Okay, so if you are looking for a way to get masks, we are selling masks. My husband and I, we imported some masks to help you, the specialist, the trainer, the coach, the doctor, get masks at an affordable price. And then what we're doing with the profits of this is that we are then getting masks that we are donating to in-need hospitals and to assisted living facilities. That website is Mask Mission 2020. It is up on the comments, wherever those are. And if you have any questions on this, please let me know. I hope you're doing amazing and doing well and everybody is staying safe. And I will hopefully see you at a live training soon, the end of 2020 or into 2021. Be well.